You could be content sitting down and just laying, in the house and watching TV. But at some point, your body's gonna tell you you're excessively doing that. He started hurting more and more from being sedentary, from being weak, and from being overweight and inflammatory as well. His pains were just started screaming at him. These pains are always just communication of our bodies. You're not in a good place. You gotta do something, it's trying to get your attention. So that's what got his attention. And he's hurting and he has no energy even to go to the bathroom or walk around the house. So that was the biggest thing. So.
Exercises to success stories. Subscribe and follow for real results.
We'll talk about another case. He was diagnosed with a rotator cuff adhesive capsulitis. Okay.
So did he have rotator cuff there too, or?
There was a rotator cuff impingement, syndrome. But also, I'd say an early onset of adhesive capsulitis. It appears more like an adhesive capsulitis.
Yeah.
But anyway, I know for the fact that for adhesive capsulitis of frozen shoulder, it takes
18 to 24 months.
12 months.
If it's a true adhesive capsulitis.
Yeah, it takes time for this condition to resolve. Doing the right things to help improve your health, and basically that's what we did. When he came in, we talked about a healthier lifestyle, and
why is it important to do that with adhesive capsulitis?
Yeah, like with diabetics, if you're diabetic, there is a likelihood or it increases your chance of developing a frozen shoulder because it's an inflammatory condition. Mm-hmm. So capsulitis is an inflammatory condition, and they have seen an increase in incidence of that in people with diabetes type 2.
Or pre-diabetic,
or pre-diabetic. He came back, so I told him that first we talk about the expected length of.
So he first started with rotator cuff, and then when he came back, it's adhesive capsulitis.
I'm pretty sure he had some issue like an impingement type of issue, and then when I saw him, there's already a diagnosis of frozen shoulder. So with these cases, I did prescribe him to do some basic range of motion exercises, and we didn't really crank the shoulder and did all that kind of okay, let's go and get that range of motion, because his shoulder is really painful and inflamed. So we just did some lifestyle advice as far as nutrition. That plays a key role. Staying active is great. He came back yesterday. He already lost about 25 pounds.
That's how long before?
Months. Several months.
You saw him few months ago for a different case, you mean?
For the frozen shoulder.
Okay, so and he was done for a while.
I told him this will just
because
because there's nothing really.
See if you're gonna thaw it or something.
Exactly, to see if we can calm down.
Okay.
So he was prescribed by the doctor. I think he also received some injection, in the past. So he did continue to do his basic range of motion exercises. He stayed as much as active as much as possible, and followed the nutrition, advice.
Anti-inflammatory.
Yeah. So he came back yesterday with a shoulder that's within functional range. So he can already move the shoulder. So things have subsided as far as the inflammatory condition. One thing that I've noticed is that he doesn't have, of course, the strength that you used to have. So he is a very active and person. I basically just prescribed him to do some exercises for strength and conditioning. And he was very patient. I think the value is that he understands that this might take a while, and I just have to be patient. And once when he learned that the process of healing, it's like this. It's not gonna be like let's force it, let's do it. There are some certain conditions that he just really can push through and ran through it. So you have to be patient. So I guess there's the value of that patience.
You've got a few things that you need to do just aside from exercising.
Yeah, aside from exercising, because sometimes what happens is that you go to a physical therapist and I have some restricted motion, I have limited movement. Let's go and get that movement back. I wanted to be able to I don't know, throw a ball or play or do my yoga or get back to doing some farm or gardening, that kind of stuff.
I think it's very important that when people come to therapy, to identify, if it's not caused by trauma, like traumatic injury, where is that problem coming from? Like in your patient's, in your client's case, it must have been inflammatory, because he responded to the diet and the lifestyle change, the regular exercise and all that.
Yeah.
And he lost 25 pounds and his shoulder is looser. And it's different for every person.
Yeah. So now the goal is just to add some strength. So yesterday, when I saw him, I prescribed him some strength training exercises. Mainly beds. And I said, I'm gonna see it in 3 months.
Yeah.
So 3 months, we'll see how it goes. Our goal is, of course, to get the range, the functional range or full range, as much as possible, and then we'll gradually build up the strength.
Yeah.
But anyway, you want to talk about one of our patient upstairs?
And it was multiple joint pains. I think it's one of the most impactful cases I've ever done as well. He was moderately obese, multiple joint pains. He is in his 40s and his mom brought him to therapy. He can't drive, he couldn't drive, so his elderly mom actually brought him to therapy, answered questions for him, and he just wasn't, just wasn't present. And he was very timid and shy, giggled and giddy whenever he thought I said something funny. But anyway, at some point though, he did verbalize his goals. He says he doesn't have any energy and he wants to have energy. He wants to be able to lose weight, and he wants to know how he could feel better with a lot of pain in his joints. So again, just like in any of our cases, education on lifestyle, the pillars of health, trying to do their best with their diet, sleeping well, putting in exercise in there, and if they're having a lot of stress, that they know how to manage those stresses. Of course, smoking and drinking is not good for your health, but in his case, he was very sedentary. He didn't have anything to do. He practically didn't have to do anything because I think his mom was doing everything for him. He was thinking for him, telling him when to eat, what to do, I think it became a cycle of he's not capable, so I'm just gonna give it to him. So it's very powerful to empower people like that. A lot of times people just do need guidance and a little pushing and shoving, reassurance, changing beliefs and all that, and teaching them a thing or two to start with, why do you feel this way? For him, it was important to talk about his diet. He had no energy because he was eating very poorly. Pretty much processed foods is what they ate, cereals in the morning or oatmeal in the morning. Oatmeal, depending on how processed it is really, really bad for you. And then, spaghetti and macaroni and cheese, things like that. With their protein, it's chicken tenders at 40-something years old. They're not mocking people that way, but we have gotten lost in our diet in America. So, and it's very, very common to see that. We were that way with our children when they were little. So I don't want to offend anybody regarding that, because everybody has, if not gone through it, is going through it right now. And we just need to teach. It'll be good to educate people on how harmful these are. So with him, he was very interested, fortunately. So I gave him the packet for inflammatory foods and all that. And the difference between 2 and 3 weeks was big. When he started pushing through, like telling mom who was doing the grocery shopping to buy this and that was great. He was starting to have energy. He sweated in his workouts. He was so happy and
What are the functional? I mean, what are the things that he, was struggling with as far as?
basically, well, everything. He couldn't lift. He didn't have no chores to do, really. Like I said, his mom
Yeah.
did
But
pretty much
so he came
everything.
in with pain, just hurt.
Came in with pain, no energy. I think that what stood up as no pain, no energy, is what got him, you could be content sitting down, and just laying, in the house and watching TV. But at some point, your body's going to tell you you're excessively doing that. So I think that's what's happened is he started hurting more and more from being sedentary, from being weak, and from being overweight and inflammatory as well. So his pains were just started screaming at him. These pains are always just communication of our body to us, a way communication to say you're not in a good place. You got to do something. It's trying to get your attention. So that's what got his attention. Is he's just sitting around, watching TV, and he's hurting, and he has no energy even to go to the bathroom or walk around the house. So that was the biggest thing. So yeah. So that guy, he got better and better, got stronger and stronger, lost some weight, trimmed his abdomen.
Phenomenal.
Yeah, and he is so proud of that. And he feels better. He's not hurting. One thing that I really tried to enforce with him, or try to encourage him to do, was before I discharged him from therapy, I made sure that he knew the importance of exercising. He got the eating down path. The exercising, once you stop moving and you start sitting again, that's gonna bring out the cycle again. Bad hormones. The cravings of foods and all that, because you're gaining weight, and you're not feeding your body right. So it escalates. So trying to get him into the gym. Just this morning, the reason why I'm telling this story is because I just saw him. It's more than a year since I saw him, and he still goes to our gym. And I always tell people, I don't care where you go. I'd be happy to see you here. I'd be like, chiming in like, hey, good work. I love, interacting with my past patients at the gym. It makes me so happy. But he's there, being vigorous on the treadmill, walking briskly and all that, and it just fills my heart with gladness.
Yeah.
Yeah. Love this job anyway. I always say that.
So if you're in the same position, don't forget that there's a lot of I know sometimes a lot of us sometimes lose hope because we are just feeling down. What we try to do here is to assess and look at you as a person instead of just like, okay, what part of your body hurts? Oh, it's my back.
Let's treat that. Yeah.
Let's treat that.
Yeah.
Our team, we always look at you as a whole, not just a body part. Like, oh yeah, he or she's a knee, or she's a back, or she's a hip. If you're a knee patient, we look at your hips, we look at your ankles, we will look at your, where you're at this, this point.
How do you move? How do you, yeah. How do you do things?
How do you do things? Yeah, exactly. So even look at balance. I mean, if you ever have back pain, there's so many things that you can do. I think we're just passionate in that way that, hey, whatever we can do to help this person overcome, their problems, why not go ahead and do it, right?
Our goal is always function. We always lean towards that.
Yes, exactly.
It's where people always say, just, I just can't reach up this way. But then the more you listen to them, that was just an effect of whatever other problems they've had, got more sedentary, and so their arm, now it's not working, sweet.
I had a couple of patients, and it's very true. When I saw them, their main goal is the guy said, he's 85 years old. The guy said, well, I couldn't raise my arm over my head, and we're going to Spain, and I need to put that luggage in the bin, and that's a big problem for me. I don't want to be dependent on anybody. And his wife's problem is balance and back pain. So they said, they're gonna leave within 6 months to go to Spain. So when I saw them, they indeed had a lot of difficulty moving around, and for the guy reaching over his head. Well, therapy has helped them so much that they ended up, going back to Spain because he was able to get his arms over his head, and her back pain resolved to a significant degree, and her balance was pretty much came back to normal. But one thing that's really also set them apart, they're very positive people. They know that that what they need to do is just to get started in a program and be consistent with it, and ask for somebody who can guide them.
That's right. Yeah.
Yeah, ask for somebody who can guide them to along the way.
Be open to help and
they were just
guidance.
This guy's shoulder is very, very severely arthritic. I mean, you can hear all kinds of noises, and it's very excited when working with him because he has that enthusiasm to improve. At the end of the day, he gained a functional range with exercises, and he also is very interested in nutrition. He said, I'm gonna do this is what I'm gonna do. I'm gonna avoid foods that makes my shoulder inflame or my body inflame, and he overcame and went back.
I think for a lot of people, the hurdle could be assumptions. Assuming that I am older, I am sick, or I'm hopeless. For those people that feels hopeless and are assuming that their age, has gotten so far that they're not, anyone that could be helped. I think that is so wrong. So care if you're a 90-year-old getting in our office or a 16-year-old or whatever, doesn't matter. I think there's always things that could be improved in one single person. Always try, always give hope a chance. That's our message for today.
And the message for today, Well, thank you. I think next time we do have a lot of patients have difficulty just like getting up from a chair. So maybe we could show them some exercises, basic exercises that will help them get their strength back. All right, cool, awesome. Thank you.